You know who I'd love to hear the information from? I'd love to hear from Kelley. So are we ready?
That's true. We want to hear directly from Kelley from the Madison County Health Department, and we'll close out the show with that.
Very good. Here's Kelley. Folks, welcome back. We are thrilled to have Kelley McBride with the Madison County Health Department. Kelley, thank you so much for joining us tonight. It's great to see you here.
Thank you. It's good to see you too, even though we are doing this remotely. You are carrying on, and thank you so much for promoting good stories in Madison County.
Well, thank you. We try. We try to do that.
You do a great job.
So, Kelley, please tell us what have you been working on this week at the Madison County Health Department?
This past week was actually National Public Health Week, and the American Public Health Association uses this week to recognize public health initiatives and service, such as protecting the quality of our air, our water, and our food, and then providing health education, nutrition education, and health services, and to improve the quality of life of everyone in our community. So we were putting up some things. I'm sorry.
Imagine a more fitting time, Kelley, to celebrate on those services.
This is true. The governor mentioned it, and you know, we're not trying to be self-serving here or anything, but at the health department, we take a day usually, and it was going to be this coming week at work, to focus in on a different aspect and a different theme of public health, and tell our staff and nurses and everybody that works in public health how much we value them and what a great job they always do. But now they are called into a response, and so we couldn't do those activities like we normally do. So we've been doing a lot of social media posts and promoting those folks and thanking those folks. And it's not just the health department, it's people in the hospitals, from the administration to the maintenance workers to everyone that, and you always think of doctors and nurses when you think of public health, but it's everyone in the whole public health system.
Absolutely. So, you know, I think it's, this is a wonderful time, folks, you know, I think here in the Madison County community to show that appreciation for, like you say, Kelley, everyone in public health. So, you know, I know it would be, what a beautiful opportunity to post pictures of gratitude, or, you know, send in different things that folks can do here in Madison County to show their appreciation and gratitude for, like you say, every public health worker.
Mm-hmm.
Wow, that would be great.
Randy, do you think we can make it happen?
I'm sure we can do something like that with my TV magic.
Oh, wonderful. Okay. Thank you so much. I did I saw a Facebook post from one of my friends at work, and she's been really working hard, and she was just saying, everybody, please just stay home, you know, wash your hands and continue on that good path, because I want to finish work and I want to be able to hug my mom again.
Sure.
And I really think I saw and felt the weariness in that comment, and I just think any kind of bit of support that we can show to these people, especially on the front lines, and our governmental leaders, our elected leaders too, that are trying to make some hard decisions. If we can show support for one another and for those working on the front lines, it would be great. Be a great help. So thank you all.
No problem.
Absolutely. Well, we thank every single healthcare worker out there. Kelley, we thank the Madison County Health Department. You all have done just an amazing job during this crisis. And folks, we've continued to share the message of staying healthy at home. Please do not let up now. This is not a time to let up. Continue the hand washing, continue the social distancing. All of the guidelines, Kelley, that you have been providing for us, now more than ever, we need to continue to do that, right?
That's exactly right.
Right.
And we need to remember that we've lost one of our members of our Madison County community in this fight. And we are seeing signs of hope, even as we continue to mourn that one that we lost. I'm going to give the case count from yesterday. So this is 24, as we speak, this is 24 hours old. But we had 19, a total of 20 cases for the county. 1 case is hospitalized. 13 cases are recovering at home. And of course, we had the 1 person who passed away. And we have 5 cases that are recovered. And I know many of you have seen the interview with the gentleman from Berea, I believe he was. He was from Berea. The interview with him, and he's recovering. He's finishing his recovery at home, and he and his family are quarantining. And just his experience, the fear, and then being able to recover and having the hope of going forward. And he wants to go ahead and help others from his experience. So we do want to highlight those good things and those hopeful things. But as you said, this is no time to let up. Right. So continuing with, like you said, the hand washing, and I know people have called it social distancing, but it's physical distancing because we're still doing things like this to stay socially connected. But don't let up on that. And something else that I'm hoping to have another subject matter expert on to speak about this. We have someone at the health department who has given me some good information about mental health tips, because as we are physically distancing and we're not able to connect in the ways we're normally used to, we need to be aware of our mental health, and whether that's children, adolescents, adults, or senior adults. We all have different aspects of mental health that we need to be aware of, and that good self-care. So he has provided, I'll let him maybe be our next guest. I'll see if he'll agree to doing that. But he provided me some local links here. New Vista, they have a 24-hour line to schedule appointments and seek emergency service. Randy, I'll give that to you, and you can make a graphic of it, and we'll share it on our website as well. So and they have so that's New Vista, and they have an app, My Strength. White House Clinics is another place. I know I'm going to miss somebody. We don't want to show favoritism one over the other. But I'm going to try to mention 3 today. White House Clinics have outpatient mental health services in Richmond and Berea, and they have, I think they have an app as well. So, and then Ridge Behavioral Health offers outpatient and inpatient mental health services, and all these have, we'll share their websites, and we'll share their phone numbers so people can have access to that. Okay. If you need to talk to somebody, they will help.
Okay. Now, Kelley, I know also you all provide, is it updates every day at 4 o'clock?
Correct. And that's what I was reading from. We have an email to our department, and then at 4 o'clock it is shared on Facebook and Twitter, on our social media, Facebook and Twitter.
That's what I thought. Right.
Yeah. Now, there's been a lot of talk about why the state's website and our information don't exactly match up. And it's just, the state is getting so much information all at once, and they have certain protocols and channels that they have to go through, and it takes time. So it's easy for us to have our local information.
Sure.
And locally, the local health departments want to share that information with their community, and so we're able to get that out a little bit quicker. We don't have to put together all the other information from the whole state. It's just for our county.
Sure. And that's a lot of information. That's a lot of data collection. So
it is. And they want to stay on top of the recoveries and those numbers. And so that's a lot of data. You're right. It's a lot of information to compile and then to report.
Yes. Yeah, it is. It is. Fantastic.
So I know. Sorry, go ahead, Andrew.
No, go ahead.
I know that several folks may have questions about wearing a mask. That is something that has been spoken about. And so could you perhaps just shed a bit of light on that, on the cloth mask?
Sure. This is a recommendation. It's not an order. There's been a little bit of conflicting information. I know the CDC website has some specifics that are fantastic, and the state website has some fantastic specifications too. They may not always match up, but this is a continuing fluid situation. So things change all the time and recommendations change. So check both of those websites about masks or cloth face coverings, because the actual masks, when we think of a mask, that is, we're going to want to reserve that for the medical workers and first responders. So we need to wear cloth face masks. And right. I know we have been the recipient at Madison County Health Department of a generous donation. A faith-based group has made cloth masks for each of us. They're donating them all over the community. So it's not just for us that they're donating. They are giving these out all across the community. So that will be helpful. So the recommendation is to wear a cloth face covering in public, or when you're at, say, the grocery store or someplace where there's going to be more people. And don't think of this as a sense of security, a false sense of security. This is not considered personal protective equipment or PPE. And we don't want people to think that this is the be-all, end-all. If I wear a mask, I can go do anything and go anywhere. Sure. And that's going to keep me from all kinds of germs. So because you're going to have to launder it and reuse it. So be smart about it. It's a recommendation, not an order. Read up about it. I know people have watched videos and have made their own masks. I am sewing challenged, to say the least. So it's been a long time since I tried to sew anything. And I was watching one of the videos and I thought, oh, well, they say it's easy. And I'm looking and I'm saying, no, can't do it. No.
A little more difficult.
Yeah.
Very good.
All right. And Kelley, for all the information that you just gave, pretty much, the clearinghouse is the Madison County Health Department's website.
You got it.
Okay.
Yes, Madison County Health DEPT.org. And we had a hotline. This is something I needed to mention. We had a hotline. We still have it, but it's not being manned. Our call volume went down, so it makes us feel good. Evidently, I guess we feel like we're getting enough education out there that people aren't calling as much. Good. And people are finding their information on the Kentucky COVID-19 website. Okay. But we still have it if we need to gear it back up. But if anybody has questions, they can call 623-7312. That's our regular number in Richmond.
Okay. And you all do a great job on Facebook and Twitter anyway, putting that information out there.
Thank you.
So, all right.
We have a great team.
Yes, you do. Yes, absolutely. Hey, you know what you should do? Send us pictures of all your team. Do you have pictures of your team on your website?
Maybe somewhere. I know we have. Of course, now we're all social distancing and not grouping up. Right. But you know what? Maybe I should ask my teammates to take a selfie, and we can kind of do a compilation.
Yeah.
We would love to see them healthy at home.
Yes,
that would
exactly.
That's right.
That would be great.
Oh, great.
Yeah. Excellent.
Showcase.
All right.
And let's have the audience here send us some healthy at home shots. That'd be great.
Photos, videos, send them, post them on our Facebook page.
That's right. Well, Kelley, once again, we thank you so much for the tremendous work that you and your team are doing with the Madison County Health Department. We are so fortunate to have you here in this community, and so fortunate for you to join us here tonight. I know that you all are incredibly busy, and we just appreciate the time to share this information with our community.
Well, we appreciate you guys. Thank you so much.
Thanks for watching, everybody. Thanks, Colleen. Thanks, Kelley.
You're welcome.
Right.
Thank you.
That will wrap us up for this evening, folks. Thank you for watching. As always, stay healthy at home. We look forward to seeing you here next week.
Madison County Live is brought to you in part by the Madison County Health Department, protecting, promoting, and improving the health of our community. The all-new Chevy Silverado, now available at Jack Burford Chevrolet and always available at jackburford.com. And by Twine Market and Design on 3rd Street in Richmond. And by kymedia.net, digital media services from top-of-the-line video production to live streaming services. Thanks for watching the show.